Welcome, doctors. We understand that administrative challenges are a constant in your practice, but there are few as time-consuming and often frustrating as navigating the prior authorization process, especially for medications like Vascepa. Today, we're going to break down what you need to know to successfully get Vascepa approved for your patients, specifically when dealing with UnitedHealthcare. Let's simplify the complexities together so your patients can get the care they deserve without the administrative headache. Now let's start by talking about UnitedHealthcare's prior authorization requirements for Vascepa. Like most insurers, UnitedHealthcare mandates prior authorization for certain medications, particularly higher-cost ones like Vascepa. Why? It's simple. They need to ensure the treatment is medically necessary and that it aligns with the patient's condition. For a medication like Vascepa, which is used to reduce cardiovascular risks for patients with elevated triglyceride levels, this step is crucial for keeping both safety and costs in check. So why does Vascepa need this level of scrutiny? Vascepa is prescribed for patients who have high triglycerides despite being on the maximum statin therapy. It's an effective solution for reducing cardiovascular events, but because of its cost and targeted use, UnitedHealthcare requires prior authorization to verify that the patient really needs it. The goal is to ensure that those who need it most get access to it, and that's where your documentation comes into play. To get through this process smoothly, let's break it down step by step. First, you'll need to consult with your patient. A thorough discussion is important here. Documenting their medical history, current treatments, and overall health status is key. UnitedHealthcare will want to see that Vascepa is the appropriate addition to their treatment plan, particularly if they're already on statins, but still struggling with high triglycerides. Make sure to document everything. This step will support your case for medical necessity. Next, it's time to initiate the prior authorization request. This part will likely involve your administrative team. They'll need to complete UnitedHealthcare's forms, making sure every detail is filled out thoroughly. Include the patient's medical history, relevant lab results, and details about their current medications, particularly their statin therapy. The more comprehensive you are, the smoother the approval process will be. After submitting, the waiting game begins. UnitedHealthcare will review the request, and this can take anywhere from a few days to over a week. If the process is dragging on, don't hesitate to follow up. Sometimes a simple nudge can speed things along. Once you receive a decision, it will either be approved or denied. If approved, you can go ahead and start your patient on Vascepa. Make sure they understand how to take the medication and any potential side effects to watch for. But if the request is denied, don't lose hope. UnitedHealthcare will provide a reason, and often it's something that can be addressed with more detailed documentation. Prepare an appeal that tackles the reasons for denial, and include any additional supporting information. Denials are common, but they're not the end of the road. Successfully appealing is often just a matter of perseverance and providing the right evidence. When working through prior authorization, accuracy with ICD-10 and CPT codes is also critical. For Vascepa, relevant ICD codes might include 𝗍𝗂𝘶𝗵 for hyperglyceridemia or 𝗨h𝗶𝘶𝗵𝗃 for atherosclerotic heart disease. Using the right codes helps ensure your submission meets all of UnitedHealthcare's criteria and helps reduce unnecessary back and forths. Let's face it, doctors, these administrative processes can be burdensome, and they take away valuable time that you could be spending on patient care. That's where support from a partner like Staffingly can make a difference. Staffingly can handle the paperwork, the follow-ups, and even the appeals if needed, helping you keep your focus where it belongs, on your patients. Our team can streamline these tasks, manage the insurance verification, and handle all coordination with insurance companies. So if you ever feel overwhelmed by prior authorizations, know that you don't have to navigate it alone. Staffingly is here to support you with insurance verification, prior authorizations, and much more, saving your practice time and easing the administrative burden. Thank you for your dedication to your patients, and remember, we're here to help make the administrative side of healthcare just a little less daunting. If you're ready to get help with Vascepa or any other medications, feel free to reach out to Staffingly at 800-489-5877 or support@staffingly.com. Let's work together to make sure your patients get the treatments they need without unnecessary delays.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.